we'll start with the way we should think about respiratory complaints. Okay. Now, all of you have been practicing, so definitely all of you have seen respiratory patients with breathlessness, with cough, and you have seen X-rays like this also. All right. Now, when a X-ray is there in front of us, which is somewhat this way, somewhere white, somewhere black, we think of a lung infection. Okay. Now, when we think of a lung infection, the commonest diagnosis which comes to our mind is either tuberculosis or pneumonia. Am I clear? Now, that should not be the way it should happen. That's what I am trying to tell you. Suppose I show this X-ray. What do you think, just roughly, could this X-ray be telling you? Based on this X-ray, do you feel any particular? There are patches on both the sides bilaterally, diffuse. So when I have asked this question, many people have said, sir, it could be tuberculosis. Okay, which should not be the way that we think about, because to diagnose a respiratory disease, it has to be knowing where is the disease, not knowing what is the disease. Just get my point. It should be to know where is the disease, not what is the disease. What is the disease? A lot of people will know. But where is the disease? Only few people will know. Alright? So our mind should be trained to come to a conclusion that this disease is happening in this part of the lung. Our mind should not be trained to know that this disease is cancer, or this disease is pneumonia, or this disease is TB. Alright? So now when we see a X-ray, what do we see is something like that. I have just put a CT scan plate so that it's more clear. The upper plates, we can see that there is a trachea, there is a black tube containing air, and then it opens out into the two airways. That is at the carina, the right main bronchus and the left main bronchus, and subsequently it divides into the lobes and then the segments, and lastly the alveoli. Now this is where the first three plates tell us how it looks on a X-ray or a CT scan. That's a radiogram. And the next two plates, the second and the third line, tell us what is actually there inside. Alright, so you can see that the first is the trachea, then next is the carina, there is the right main bronchus, right middle lobe, left main bronchus, left lower lobe. So this is what we will be trying to find out. Is the problem in the lower lobe, or is it in the middle lobe, or is it in the lumen, or is it arising, or is it in the lumen of the bronchus, or is it arising from the wall? Okay, this much at least we should be aware of. And still going further, then the right main bronchus, right upper lobe bronchus. So this is how the airways are from inside, and this is what we see on a bronchoscopy. Okay, the tree is somewhere like this. Now the X-rays will not reveal this. X-rays will just reveal a haziness. That's why it's difficult on an X-ray to know whether it is TB or staphylococci or streptococci, or whether it's a cancer also. But compared to that, when we see from inside, we can identify exactly what type of disease it is. Now this is the anatomical, this is from a book picture which says that the trachea, then the right main bronchus divide into three lobes. I am trying to say this again and again because when we see a patient who says that I am getting a pain on the right side, सीने में दर्द हो रहा है, and I am feeling breathless, and you auscultate and you find that there are crepitations, we will come to that, what is crepitation, but when you auscultate and you find that there are crepitations, your diagnosis should be actually imagining his right main bronchus, and then the segmental bronchi, and then the alveoli, and there is a problem in the alveoli. So those things should be imagined when you are actually auscultating the patient. If you just end your thoughts, there are crepitations, nothing beyond that. That's not the way we should approach. Now this is, the earlier one was of course the book picture, and this is the actual picture of the lungs. This is what is a checkup called as a bronchogram. Earlier, long back, they used to put a dye in the bronchi and they used to take a picture. So this is how the bronchogram used to look, with the trees and with the, it's an inverted tree appearance. That's what even the books will tell, that it's an inverted tree appearance. And this is how a CT scan will look. See, we are now going through all the images. The X-ray will look like that. The bronchoscope will show like this. The anatomy is actually that way. And the CT scan will show something like this. So we are going to see the CT scan and the X-rays more frequently. Now putting all this together, the investigations together, we have to go into the symptoms. This I think you should, whoever is noting it down should note it down, because this is very important. Whatever the talk is going to happen is based on this slide. So any symptom, any disease or any complaint of the patient has to be segregated into 6 parts. One is whether it's an airway disease. Now when I say airway disease, what does it mean? It means the lumen. See, the lungs, just listen, the lungs start from the nose. Okay, that's the perception which has to be. Nose, then the pharynx, that's the nasopharynx, then the larynx, then the lumen of the trachea, going into the bronchi, the bronchioles and the terminal bronchioles and the respiratory bronchioles. So any of these lumen throughout would be termed as airway diseases. Okay, the first thing is an airway disease. Airway disease is what? Airway disease is problem in the lumen of the flow. It's the flow which is affected, flow of air, flow of oxygen. So that is an airway disease. Once the terminal respiratory bronchioles end, they end where? They end into the last unit of the lungs, which is the alveoli. Now this alveoli is termed as parenchymal lung disease. So the lung alveolar diseases are termed as parenchymal lung diseases. The alveoli has a basement membrane. We all know that there is a basement membrane to the alveoli. And beyond the basement membrane is the interstitium. There is a space beyond the basement membrane which is called as the interstitium. So that problem over there is called as the interstitial lung disease. In the interstitium lies the pulmonary capillaries, which are supposed to be taking oxygen from the alveoli to the left heart. Problem in the capillaries would be vascular diseases. So that finishes the lungs. But beyond the lungs there is a pleura. Any disease of the pleura would be called as pleural diseases. And beyond the pleura comes the muscles, the rib cage. So it's a neuromuscular diseases. So now this segregation is very important. Why it is important is because, I'll just tell you, because all these 6 different places of disease give rise to 4 symptoms. That is cough, breathlessness, chest pain and fever. The symptoms are going to be the same. It's going to be cough, breathlessness, chest pain and fever. Beyond this, there are no symptoms which are there in the respiratory system. Okay, it has to be more of cough, less of breathlessness, or in some patients more of breathlessness, less of cough. In some patients only fever with cough, in some patients only chest pain with breathlessness. So it all depends on the plus or minus of these symptoms. So when a person says, मुझे सांस लेने में तकलीफ है, मुझे खांसी आती है, our mindset, if it is working, it's asthma. It should not be so. Our mindset should be working where? Is it a airway disease? Is it a parenchymal lung disease? Is it an interstitial lung disease? Is it a pulmonary vascular disease? Is it a pleural disease or it's a neuromuscular disease? Once we are certain, okay, it is only airway disease, then you give it a name. Asthma, bronchitis, emphysema, COPD, whatever you want to call it. But before that, if you just start making an impression that this is TB, this is pneumonia, first try to make that finding correct. That will be able to do it, but it's just a matter of time how you do it. Now we'll go back to this. Now this was what I was talking about, that the lumen, that is the terminal bronchi, that is the TB which has been written, then the respiratory bronchiole, so then the respiratory bronchiole into the generations of the respiratory bronchioles, and last is the alveolus. So any luminal disease is a airway disease, any alveolar disease is a parenchymal disease. Okay. Now this is again, yes. So any, that is the terminal bronchioles.